So in the discussion between our group members, we identified the need to study the long-term metabolic effects of anti-cancer treatments. Anti-cancer treatments have a potential long-term effect on metabolic health, that includes the risk for diabetes and its complications. And understanding those effects is important, both in order to choose the initial cancer treatment, but also to personalize the post-cancer follow-up, diagnostics, and treatment of metabolic disease in these patients. Right now, there is definitely a knowledge gap this question. So we would like to address this gap with a study that combines an epidemiological wing, the in vivo and molecular methods as well. And we're lucky to have in our breakaway room specialists in the different fields that would enable us to do such a program. We decided to focus on breast cancer and colorectal cancer, as this seemed to be most in line with the specialties and current work of the different group members. So the epidemiological wing would be retrospective, and it would rely on patient registry in Denmark, which are very detailed and very fitting for such a project. We will collect and process information about the individual patients on cancer type, treatment that they received, and blood test results with focus on metabolic function, and so on and so forth. And we would use family members of patients receiving the cancer therapies as best controls for the study. And of course, we'd be looking to collate the different layers of information to identify the effects on metabolic health that happened following the treatment in subsequent years. Now, the in vivo wing is a mouse tumor model. We can several different tumor models, but the one that seems to be very advantageous for this type of study is a model that was described by Mikola, that is she's actually working on and is well familiar with. And it's a syngeneic lung epithelium-derived adenocarcinoma model, which generates an ectopic lung cancer. And it is actually a model that is currently in use. So she is actually able to start a pilot study within the near future. Now, one of the biggest benefits to this particular model, the advantage is that it has a relatively low survival time, up to 40 days, which allows for more and longer interventions, and it also gives more time to measure outcomes. Because of course, as we can get to the chronic situation in human patients. And interventions that would happen in the mice would be, of course, the different types of chemotherapy to emulate as closely as possible treatments received by the human patients. And we could follow up with those treated mice with diet-induced obesity. And we would be sure to include controls that would allow us to differentiate effects of the tumor versus effects of the treatment on the subsequent metabolic state. So that would include the treatment groups and tumor-only groups. And in these mice, we could do a wide variety of outcome and parameters, which would include strength and endurance assessment, pulmonary test and pulse oximetry. We could look at glucose homeostasis, glucose tolerance, and an insulin tolerance test. we could look at measurements for blood pressure as a measure of vascular function in vivo. We could also look ex vivo vascular reactivity in pulmonary artery and aorta. Of course, we would use tissue samples from different organs, both for staining and of the sections in order to identify gene expression and general morphology of the tissue. We could also use the tissue samples to perform next generation sequencing or single cell sequencing and enable us to identify molecular signaling pathways affected by the treatment that could be responsible for metabolic outcomes. And then once we have candidate pathways, we can validate them. We can validate candidate gene expression at the mRNA level. You'll use quantitative RT-PCR, the protein level using immunoblots. And we could also target particular vectors or genes for pharmacological modulation. So the outcome that we expect to get is to characterize, first of all, long-term metabolic effects of anti-cancer treatments. And we could also identify the molecular mechanisms that mediate those effects. Now, if we know the effects of anti-cancer treatments in the long term, we can then use those to formulate recommendations for post-cancer follow-up, diagnostics, and treatment of metabolic diseases that might be different in cancer patients than in the general population. And the molecular mechanisms that we hope to identify would also provide us with new targets for therapeutic intervention. This is it. Simon, would you like to anything? Any additions from Simon or any?
No. I think you gave a good point already, Ari. So what we need is just to hear feedback from the others. Yeah.
Absolutely.
Thanks for a really nice presentation. I would like to ask, what tissue would you like to do the sequencing in? Like, what kind of cells would you like to look at molecular differences?
I had a hard time hearing this. Could someone repeat it, maybe? Because you're far from the microphone.
Can you hear me now?
Better.
Okay. In what cells would you look at the molecular, like the sequencing analysis that you would do in single cells? What cell types would you look at? The tumor or some other tissues?
Well, no. Well, I mean, it wouldn't be the tumor. It would be ideally the tissues that would be the metabolic tissue would be affected by the treatment. Right, so that's our primary target. So we look at liver, we could look at muscle, we could look at the blood to some degree, even though it's not a metabolic tissue, but it'd be very informative about what happens systemically as far as signaling. And there's a couple more that I failed to mention, but the focus would be in the target metabolic tissues.
Thank you.
I have a question. Thank you. That's a cool study. We sort of had similar ideas in our group. Regarding the chemotherapy, is it? I'm less familiar with that than I am with endocrine therapy. Is the chemotherapy itself thought to contribute to metabolic disease, or is it the steroids that are co-administered, or maybe both together? And would you try to pull that apart in your mouse model a little bit? Would you give steroids as well to the mice?
So I think that's a great question, and I think that we need to do more homework as far as designating the specific treatments for groups. But to the degree that we're emulating combined treatment, would also have to feel apart that combined treatment, and just in the way that you mentioned right now. I think that would be the right thing to do.
Any other questions?
Anyone else? Don't be shy.
You could do the same study with other, like a syngeneic breast cancer model as well. I think that we all probably in both groups agree that having an immune system is important, even though sometimes that's not possible with certain tumor studies. But there are definitely breast cancer cell models that could be used also, and maybe that would give you information about different treatments too.
And that's a great idea. And in general, I think that more than one mouse model would be formative. And we just jumped at this opportunity because as it was presented to us, so in such a lucky fashion. But I'm sure there's certain benefits to other models as well that I might not be familiar with. So thank you for the idea.
Okay, should we continue to group? Thank you very much.
Thanks for the wonderful and very, very, very incisive feedback. I really appreciate it.